So if you're just missing one tooth, why a dental implant over traditional dentistry, like a bridge or whatever?
Oh, the implant, if you have the choice, is so much better. For one thing, we're not having to do anything to the adjacent teeth. So we're not harming anything there. And bridges, they don't last forever. In fact, 10 to 15 years at most. So we're not setting them up to lose more teeth. We're not asking fewer teeth to do the work of many. We're going to go through a lifetime of continuing to lose some bone in that area.
If you don't do a dental implant.
If you don't do a dental implant, because that implant is going to help hold bone in place. It's going to help hold the best environment cosmetically that was ever there, the one God gave you.
So even if it's a front tooth, you can match it up?
You know, we can match it perfectly. One of the hardest things to do on the planet is to match one central incisor perfectly with the other. We can do that. We have the technology. We have a gentleman at the laboratory that can match that tooth perfectly, and he cares so much about every result that he will do it.
You think you have the best, you told me this on the phone. I was like one of the best lab guys in the world.
I know he is.
As far as making realistic
You don't see it every day. And as far as the cosmetics and the things that we see, the things we value, the vitality, how they look in a smile, but technically, they're perfect too. And you know, Rich has just so much integrity. He makes sure that it's perfect.
Okay. Now what about pain? It seems very painful to get an implant.
You know, you would think so. I mean, I would think so. Sometimes you take a tooth out, sometimes you remove a little bone, and you would think that would be painful, and then we're going to put a glorified screw in there, your head.
Mm-hmm.
But it's not. We hear it over and over. And people come back and they say, you know, I took a Motrin for maybe the day after,
Okay.
or a few, and they do great.